doesn't just sort of stop in the business arena. I mean, as Stephen knows over there, we have a burgeoning sports science department, and in fact, the Aon Training Complex, which is our training ground, has effectively a mini hospital in it. So we have a CT scanner, we have an MRI scanner, and the data that's throwing off, or will throw off, because it's only just started, it's only just been put in place, in terms of player health, how many times we scan them, can we start to predict players who are injured, should they train today, that sort of data. That's the area of sports science is absolutely blossoming at the moment.
Yeah, I think there's no doubt. So we've some interesting use cases in IBM, work that we've done in College Hospital in Ontario and with the University Hospital in Cork here locally, where we can take many thousands of measurements of things like respiration and blood pressure and different blood results from the smallest children to try and identify in the very, very youngest Irish citizens if they have things like infections developing early, so that the clinical team can identify that good and early and act. But some of the issues I think are the same. I think culture and openness to make decisions based on these kinds of expert systems are very, very interesting. To borrow from Phil's presentation, we've done some work with the Leicester Tigers, a professional rugby football team. And if you look at the jerseys in the Heineken Cup games now, most of the players have a little divot in the back of their jersey. Well, there's a sensor package, and it measures things in training and matches like, again, blood pressure and respiration, collision rates, momentum. And you can get some amazing insights. So you can identify when, because 50% of the squad play 80% of the rugby. So your best players get injured more. When they get injured, you start to score fewer tries, you start to concede tries, your gate receipts go down, you get less Sky money, your ERC money starts to disappear, so it's really, really important. And so you can get these amazing insights into who is likely to get injured in the course of an Ulster match, but you go and try and tell Stephen Ferris, Stephen, you're coming off, because the computer says you're going to be ill, and he'll say, go away, little man. So culturally, I think the willingness to make decisions based on some of these data sources, some of these insights is interesting.
Technically, I mean, most of the players, when they train, will wear GPS monitoring and heart rate monitors and things like that. We're collecting something like 10,000 pieces of data per week from the squad on training, and that, like I say, that's going to go up when the medical centre kicks in the early new year. So there's so much data that you actually do need outside perspective in order to make some sense of it. And also, of course, everybody who's in Manchester United is a sports expert, but they may not have thought about certain other areas of medicine or training or whatever. And that's where the outside thinking of people like our friends at Aon will hopefully help us to develop.
It's a bigger country. It's a bigger geography. We have proximity to the US. The uptake on the internet was very early, so we got a bit of a head start, perhaps in the open data movement. But in terms of health, for instance, organizations are using health for social determinants of health, trying to understand health inequalities and health outcomes. Chief medical officers of health are, of course, using data in different cities. Montreal, in particular, are doing a fantastic piece of work on all kinds of interesting mapping and demographics and barometers to try and understand the health of the city, right down to urban heat island effects and when firefighters have to go out and deliver water to the population in certain areas when things are getting too hot. But when we think of that same kind of context here in Ireland, you have the All-Ireland Research Observatory that just released a health atlas here in Ireland, and they're doing north and south comparisons about how people perceive their health. So Stephen Prentice was talking about how people feel. Well, this is about how people feel about their health and their health outcomes. And so those kinds of data being represented usefully in visualizations, in maps, in different types of tables and charts, and being shared out into the public along with the raw data, provide the potential for decision makers to make informed decisions of where they're going to target their efforts, where they're going to locate hospitals, where they're going to locate services, where the elderly are going to be located in a country, and where we need to do some planning to try and start delivering those services. And I think one of my favorite applications, similar to what you were talking about, is one that the Ontario Medical Association of Health put together using public data, trying to understand what is the cost to the healthcare system of poor air quality. So you're starting to look at air quality data, environmental data, particulate data, respiratory illnesses, intakes at hospitals, and what does that cost the society? What does that cost the hospital system? To try and look at an economic way of modeling environment and health and trying to find ways to address it. That's all public data. And it's public data that's generated by hospital administrations, or it's demographic data like you would have here from your statistical agency, or data coming from your environmental protection agency, all being used to try and analyze and do this kind of work. So I think it's very interesting to start thinking about how we can work with some of the private sector data, some of the sensor data that I think is becoming very rich here in Ireland, and some of the flow data, and data like yours that you're working with sports research, and seeing if we can merge those with public data and inform public policy in a useful way.
There really is a concern. I think we need to be really careful and really alive to the threat of this, because so we've got big data and we've got these big social media platforms, some of the big public data platforms as well, and that's all great. I think there's out there amongst the users, the consumers, there was the early adopters and the teenagers, the naughties who just bought into it without any kind of reservation of where this might go. But I think we're getting to a stage now. I'm in this industry, so I'm concerned about how my personal data is being used in different places. Okay, I'm in this industry, so I'm more alive to this threat. My wife was really spooked out by one of the phrases from one of the earlier speakers. She was really creeped out whenever she saw a photograph of our son popping up somewhere within Facebook that she didn't expect to happen. Now, she's a very novice and kind of disinterested user in Facebook. So if somebody like that who wants to consume the media in that way, in the social media way, is starting to get a little bit worried about how her data is being used and is confused and is getting anxious, that presents us as an industry with a problem, because it's only a hop, skip, and a jump before the consumer starts to get worried about how Facebook is manipulating their data, to them losing trust in that platform and that industry, to those consumers losing trust in us, their providers. And that is a really big threat. And I don't have any easy solutions to this, but I do think from an attitude perspective, we as an industry, we have to just be a bit more open about how this, what the grand bargain is. So if the grand bargain is, we will give you lots of digital goodies, you can use your Gmail and your Facebook and your whatever your chosen technology is, you can use all that for free. If that's the grand bargain, in exchange for us using your data to sell advertising or to sell or to do any of those data gathering exercises, if that's the grand bargain, let's be open about that. And I think most people will be cool as long as they understand it's the uncertainty that comes with all of that. How's this stuff being used? And I didn't think that was going to happen when I downloaded this update on my app here. That uncertainty is a killer for us as an industry, and I think we have to be open. I think we have to address that.